CHF. We are glad that you're still with us. I'm Christina Villela, and I am joined by my colleague, Dr. Olivia Velez. We're the co-chairs of the Global Digital Health Network. Before we introduce our final plenary, we wanted to share a few closing remarks and reflections after spending 3 days at the Global Digital Health Forum 2021. We have spent the last few days engaging in high-level plenary discussions, meeting colleagues in virtual booths and trivia games, and learning about the latest innovations in digital transformation through our numerous panels and workshops. We were thrilled about the diverse participation of attendees and speakers from across the globe, which continues to show how digital transformation presents opportunities to break barriers and build bridges, especially because some of us are still unable to travel abroad. The focus on the theme improving health through digital transformation resonated through all the presentations, most notably through the keynote address. Dr. Chikwe Ehekwazu noted how all health challenges start locally, and therefore we need to focus on utilizing and strengthening local institutions for analyzing and using data to combat our current health challenges and those in our future.
We observed a strong commitment to people-centered approaches and collaboration, acknowledging that the tech will always be there, but a commitment to digital transformation is needed at all levels, whether it be from users, governments, or service providers. We learned about the power of communities of practice and collaborative intelligence in addressing our most complex health challenges. We saw a continued commitment to leveraging digital transformation to scale up and accelerate health service delivery up to the last mile. We were excited to observe sessions not only focused on interventions for COVID-19, but also sessions on the strategic digital health post-COVID-19 interventions, incorporating lessons learned in the 2 years of managing the pandemic. Christina, what was one of your favorite moments from the forum?
Well, if I had to pick just one, it would be finally experiencing what is becoming a forum tradition, playing the Architects of Digital Health, the board game. I finally got to see this board game in action in its 3rd appearance at the forum. The game is not only a fun way to quiz your colleagues on architecture-related jargon, but it also makes you think critically about the choices a country has to make in building its health information exchange in the face of limited resources and the inability to choose to build up all parts of the health information exchange at the same time. Olivia, what did you love about having a virtual format this year?
Surviving the great Amazon Web Services outage of 2021, that really feels like something I'll tell my kids about. However, in all seriousness, I really appreciate that all the presenters were pivoting and just able to roll with the flow, and we were able to continue with the great presentations and discussions. What was your biggest takeaway, Christina?
Reflecting on this over the last few days, while we've had our high-level plenaries and been attending panel discussions and meeting with tech demo exhibitors. And I think that while there are a lot of high-level initiatives happening to support digital transformation for health, and there's a lot of people working to tackle all these big challenges that we're facing, there are also a lot of smaller interventions that are having a significant impact on health. And for various reasons, we're not hearing about them. Maybe they're not as widely disseminated or as talked about as much, but they are having a significant impact on health outcomes. For example, when I was visiting one of our tech demos the other day, I learned about these self-service HIV testing booths that were located just outside the facilities. And these booths provide a private place for clients to do a self-test for HIV. And then if they test positive, do a self-guided counseling module right there in the booth. And this actually improved reporting of positive results. And the presenter told me that the reason for this was that many people just want a private place to do their test and to learn more about their positive results without the stigma that comes with getting an HIV diagnosis. And so this really drove home for me the need for us to continue to find ways to weave together all the players in digital health, from government all the way to small business entrepreneurs and those working at health facilities, and why these types of convenings are so important so that we can learn from each other, learn what we're doing, learn what works, what doesn't work, and to see the breadth of what is happening in the field of digital health and digital transformation. How about you, Olivia? What was your biggest takeaway?
For me, it was the importance of inclusion and diversity in digital transformation efforts. In the Healthcare Recoded plenary on Monday, the speakers talked about the need for a diverse workforce to reduce AI bias. And I thought that was really important. On Tuesday, I led a plenary on digital inclusion, and we talked about the need to build trust with consumers about interventions and tools, and also about how to protect them against cyber crimes, which I think is also really important. Finally, a standout panel for me was improving HIV health equity among transgender people, as gender identity has been a significant blind spot in the global health space. One of the speakers shared a really impactful personal anecdote, and it was really great to see such impactful work presented here. So speaking of inclusion, GDHF is the annual event hosted by the Global Digital Health Network. Formerly known as the mHealth Working Group, the network was established in 2009 and now has grown to over a 4,000 person strong community of practice with members from 117 countries who share information daily, engage with the broader digital health field, and provide leadership in digital health for global public health. Our events and listserv are an avenue to share practical and flexible guidance amongst each other. GDHN membership is open to all, and you can find out more and sign up in the About section of the forum website.
The network and all its events are for the members and by the members. As co-chairs of the Global Digital Health Network, we loved getting to see you, all of our members, come together to make this year's forum possible. The overwhelming majority of our content is sourced by our members via our call for abstracts. We would be remiss not to acknowledge that the success of this year's forum is also due to the incredibly hard work of many people, including the Global Digital Health Network Advisory Council and our event management partner, Federal Conference. We extend our most sincere gratitude to the Planning Committee for making this forum a success through your time and expertise. Finally, the success of the forum would not be possible without our sponsors. Our sponsors range from the private sector foundations to NGOs to donor organizations based in Africa, Europe, and the Americas. Sponsors, thank you for helping make GDHF 2021 a success. Thank you for prioritizing digital transformation for health and supporting us in providing a space for sharing, learning, growing, and collaborating. At this point, we would like to hand it over to our GDHN Advisory Council member and past co-chair, Steve Allis, to announce this year's winner of the Marc Mitchell Leadership and Innovation Award.
Hello, everyone. My name is Steve Allis, and I have the honor of introducing this year's winner of the inaugural Marc Mitchell Leadership and Innovation Award. Marc Mitchell was a pioneer in the field of digital health, focused on improving the quality of healthcare and health systems through the use of digital technologies. And he did this through the development of electronic decision support tools for frontline health workers, and early on saw the potential to integrate these tools into a comprehensive healthcare system. Dr. Mitchell's work in digital health was guided by his passionate belief that all people everywhere should have access to high quality healthcare. And so in the spirit of Marc's work, we're pleased to present this award to Eimy Barahona, who is a physician and social entrepreneur who co-founded TeleSAN, the first telehealth network in Honduras. And she's currently completing a joint master's degree in public health with a specialization in environmental and occupational health sciences. So welcome, Eimy, congratulations. We'd really like to hear more about the inspiring work that you and the TeleSAN team have taken on.
I would like to thank you, everyone, for this honor and the staff of the Global Digital Health Network and my team, TeleSAN. I'm a co-founder and coordinator of TeleSAN, a telehealth network that provides health services through virtual beings in indigenous and isolated communities. Through its digital platform, we offer to these vulnerable communities remote connection with a specialized medical expert from various hospitals in the Honduras capital. This through the internet, accessible biomedical equipment, sustainable energy, and a network of medical specialists. Through TeleSAN, distance are not an obstacle to improve health and nutrition. With the use of technology, we are improving the health access and generating significant savings because it reduces the need to travel outside the communities. Currently, it benefits more than 25,000 people, especially for children of young age and pregnant women. Due to its success and the hard work of my team, I am proud to say that TeleSAN is going through a phase of national expansion. we have managed to work with the Ministry of Health of Honduras, and in conjunction with the international cooperation, we have achieved a nationwide expansion to 50 health establishments. Our current goal is to expand the other regions in Latin America, where health services are inaccessible. And I'm looking forward to see TeleSAN improve health inequities across Latin America. As for myself, I am currently pursuing a master's degree in public health with a specialization in environmental and occupational health. I am hoping this experience will allow me to have the knowledge and the skills to expand TeleSAN and make it even greater. My goal is to generate a change in the social inequalities that are facing my country, such as many others. Thank you.
Great, thank you, Amy. That's really, really inspiring. Inspiring to hear. It's great work. And the award for this year includes a mentorship opportunity and a travel scholarship for the 2022 Global Digital Health Forum. So we wish you the best of luck. We are expecting to hear great things about this work. We're looking forward to hearing from you at next year's Global Digital Health Forum, and good luck in your studies and to you and the TeleSAN team. So thank you so much for making the time for this, and congratulations. Should be a great honor for you.
Thank you again for inviting me, and thank you for the work.
Congratulations, Dr. Eimy. We look forward to welcoming you to the forum next year. We take this opportunity to thank speakers, presenters, and participants for making GDHF 2021 a success. Over 2,000 participants from over 100 countries joined us. Thank you all for your commitment, support, and dedication to improving health through digital transformation. We also want to thank our speakers, presenters, and participants for making this event such a success. Although there's a lot of progress that has been made in managing COVID-19, there remain many challenges, especially for those who are looking after a sick family member who work directly in preventing and treating COVID-19, or for those whose daily lives have not returned to normal again. We thank you for participating in these discussions. As we come to the end of GDHF 2021, join us in welcoming our final panelists who will talk about insights on the importance of trust in harnessing social media for vaccine confidence.